The truth about colonic diverticula, asymptomatic or symptomatic. Have you ever wondered about colonic diverticula and whether they cause symptoms? Let's dive into this topic. Colonic diverticula are small pouches that form through weak spots in the wall of the colon. Interestingly, most people with diverticula do not experience any symptoms. In fact, about 80 to 85% of individuals with diverticula have a condition known as diverticulosis, which is usually asymptomatic. These diverticula are often referred to as false diverticula, as they only involve the mucosa and submucosa layers pushing through the muscular layer of the colon. However, there is a significant minority of individuals who do develop symptoms. Approximately 15 to 20% may experience what is known as symptomatic diverticular disease. This can range from mild abdominal discomfort to more severe issues like diverticulitis, which is an inflammation or infection of the diverticula. Symptoms of symptomatic diverticular disease can include abdominal pain, changes in bowel habits, rectal bleeding, and sometimes even anemia. One specific condition related to diverticula is called symptomatic and complicated diverticular disease, or SUD. In SUD, patients may have abdominal symptoms without any overt inflammation. Research suggests that this condition may involve increased sensitivity of the colon, possibly due to low-grade chronic inflammation and changes in the nerves of the colon while near the diverticula. This is different from diverticulosis, where such nerve and inflammatory changes are typically absent. It's also worth noting that the presence of diverticula can be associated with other health conditions, such as hypertension and diabetes. Additionally, there is a link between diverticulosis and adenomatous polyps, which are precancerous lesions. While diverticulosis itself is generally benign and asymptomatic, complications like diverticulitis or bleeding can lead to symptoms that requiring medical attention. From the perspective of diverticulitis, the focus shifts to the symptomatic and complicated forms of diverticular disease. In these cases, inflammation can lead to significant pain, infection, and even serious complications like abscesses or perforation. These situations are clearly symptomatic and often necessitate diagnostic imaging and treatment. To summarize, most colonic diverticula are asymptomatic and are often found incidentally during procedures like colonoscopy. A minority of individuals develop symptoms, which may include abdominal pain, bleeding, or inflammation due to diverticulitis. Symptomatic diverticular disease can involve visceral hypersensitivity and low-grade inflammation without full-blown diverticulitis. Complications from diverticula, such as diverticulitis, are symptomatic and requiring medical management. Understanding the difference between asymptomatic diverticulosis and symptomatic diverticular disease is crucial for proper diagnosis and treatment planning. Always remember to consult with healthcare professionals for personalized advice regarding your health.